welcome to Layla Teachers. Today we will speak about the control of the heart by different factors of the autonomic nervous system or the chemical control or the central control. But we'll start with the effects. So we have different effects on the heart on different kinds of things. For example, the heart rate, the contraction of the heart. So we'll start with the effects, and I've split this video into 4 parts. First is the 5 different types. The first one is the heart rate. Then we have the conduction velocity, contractility, excitability, and myocardial relaxation. And all of them have a name that ends with tropic or tropic, and you need to remember these names. So for the heart rate is chronotropic, then conduction velocity is dromotropic, contractility is ionotropic, excitability is bathmotropic, and myocardial relaxation would be isotropic. The contractility is very important, and when we make changes to the contraction, it is usually due to calcium release from 2 types of channels, T-type calcium channels, and we've also got the funny channels. They get phosphorylated and they open up and they release calcium ions, which is needed for heart contraction. Then we go on to the conduction velocity, where it's to do with the uptake and storage of calcium by the sarcoplasmic reticulum, and this is what increases the conduction velocity and the force of the contraction. It is to do with a protein named phospholambin, which phosphorylates and stimulates the calcium ATPase. Also, the heart rate is important, and it is controlled by the sinoatrial node, which is under the autonomic nervous system. Moving on to the central control, which is by the central nervous system, you've got the autonomic nervous system, which has 2 divisions, the sympathetic nervous system and the parasympathetic nervous system, which decreases the heart rate, and the sympathetic nervous system increases the heart rate and contraction. So you've got 2 types of receptors under sympathetic. You've got the adrenergic ones. So you've got alpha 1 and beta 1 adrenergic receptors. They increase the heart rate and contraction and conduction velocity, but they have 2 different pathways. So the alpha 1 has the inositol triphosphate transduction pathway if this particular receptor is stimulated, and this causes calcium release from the sarcoplasmic reticulum, as I mentioned. Then we have the beta 1s, they're located on the sinoatrial node, and they activate the CAMP, the CAMP second messenger system, which is the CAMP dependent kinase pathway. Then we have, for the PNS, we've got the muscarinic receptors, and they are the M2 cholinergic receptors. We've got M1 to M5 and N1 and N2. So for the heart, we've got the muscarinic M2 cholinergic receptors, and they're located on the sinoatrial nodal cells, and they cause the opening of the potassium channels because they reduce the heart rate, and so they suppress the opening of the funny channels and the T-type channels, calcium channels. So the net result is a decrease in the depolarization, while in SNS, you have an increase in the depolarization, which is why you have increased heart rate and contraction. And in PNS, you have decreased depolarization or sometimes even hyperpolarization, which is why we get a decrease in the heart rate. Now, the neurotransmitter for the sympathetic nervous system is norepinephrine or epinephrine, while for PNS, it is acetylcholine. Now we'll move on to the chemical control. We need to remember two things that come under this is the potassium ions and the calcium ions. Both are very important. Now the potassium ions, they decrease the rate and force of contraction, as we mentioned earlier, which is why the PNS affects the potassium channels, and it decreases the rate and the force of the contraction. And the calcium ions, they increase the force of the contraction. The excess calcium ions, they are from the T tubules that added to the calcium released from the sarcoplasmic reticulum. So there's more calcium as a result, and then therefore it's more available to the contractile machinery and the force increases. For the potassium, it decreases the resting membrane potential, and therefore the force of contraction gradually decreases. But excess potassium and excess calcium are not good. Excess potassium is called hyperkalemia, and it reduces the force of contraction so much that the heart finally stops in diastole, which is important for you to know. That a teacher might ask you, in which stage will the heart stop in hyperkalemia? Then we've got excess of calcium, which is called hypercalcemia, and it leads to the heart stopping in systole, and this stoppage is known as the calcium rigor. Moving on to the last part of this video, the hormonal control. We've got 3 different hormones, the important ones. You've got the antidiuretic hormone, the angiotensin II hormone, and the epinephrine hormone, which is also like a neurotransmitter. The antidiuretic hormone is also known as arginine vasopressin. Normally you hear it as a vasopressin, and it is released from the posterior pituitary when the tissue osmolarity rises or the blood volume decreases, and it controls the extracellular fluid volume through renal water retention, and it affects the vascular smooth muscle cells directly via the receptor ADH-V1. Then you've got the angiotensin II, which is a potent vasoconstrictor, and it is stimulated by the sympathetic nervous system as well, and also when the renal artery pressure falls. So it appears in the bloodstream, and the receptor is AT1A. It acts on the vascular smooth muscles too. Then we have epinephrine, which we've already spoken about, but it is really produced and released by the adrenal medulla during sympathetic nervous system activation, and primarily it affects the myocardial contractility and the heart rate. It increases both of them, and if it binds to the alpha on the vascular smooth muscles, it potentiates the direct symptomatic nervous system mediated vasoconstriction. So you could say it's a vasoconstrictor, but if it stimulates the beta 2, if it binds to beta 2 adrenergic receptors, it mediates epinephrine mediated vasodilation. So it can be a vasoconstrictor and a vasodilator. That would be it for this video. Hope it was understandable. See you later.